Avian influenza, a perfect storm of pandemic potential, political pressure, and public peril. The United States is grappling with a devastating avian influenza outbreak, sending egg prices soaring to record highs and raising critical questions about our national preparedness for zoonotic diseases. While the crisis unfolds, a complex interplay of scientific research, political maneuvering, and public health concerns is shaping the nation's response. The recent announcement of federal funding for avian influenza research projects offers a glimmer of hope, yet the situation remains precarious. The United States Department of Agriculture, USDA, has declared its commitment to combating this escalating threat, allocating significant funds towards crucial research initiatives, including the development of novel vaccines and innovative treatment strategies. The Animal and Plant Health Inspection Service, APHIS, the USDA's frontline agency in this battle, has announced a significant expansion of its biosecurity evaluations. This proactive measure extends beyond farms already impacted by the virus, encompassing a broader swathe of poultry operations to preempt further spread. This proactive strategy aims to mitigate the devastating consequences of the outbreak, recognizing that early intervention is paramount in containing this highly contagious disease. However, the allocation of these vital funds comes against a backdrop of political turmoil and conflicting approaches to disease management. The controversy surrounding the proposed cuts to the federal workforce, amidst demands for significant downsizing, has cast a shadow over these crucial initiatives. While a department spokesperson clarified that several jobs involved in avian influenza response were exempt from the proposed cuts, the uncertainty surrounding funding stability remains a genuine concern. This precarious situation underscores the critical need for sustained and consistent investment in public health infrastructure, independent of shifting political landscapes. The debate surrounding the appropriate response to the outbreak extends beyond resource allocation. Recent pronouncements from prominent figures, including Robert F. Kennedy Jr.'s suggestion of allowing the disease to run its course among birds to foster natural immunity, have ignited a firestorm of controversy. This controversial perspective, dismissed by many leading experts, raises serious ethical and practical concerns. The potential for uncontrolled spread, the devastating economic consequences, and the inherent risk of zoonotic transmission. The jump from animals to humans makes such an approach highly irresponsible and potentially catastrophic. Dr. Gail Hansen, a former state veterinarian for Kansas, succinctly summarizes the prevailing scientific consensus. That's a really terrible idea, for any one of a number of reasons. Her statement underscores the gravity of the situation and highlights the critical need for a scientifically driven, evidence-based approach to managing this outbreak. The potential for human infection, coupled with the devastating impact on the poultry industry and the broader economy, necessitates a comprehensive and well-resourced response. The current situation is far from ideal. The overlapping challenges of containing a rapidly spreading virus, navigating political pressures, and addressing the complex economic consequences demand a unified, scientifically informed national strategy. Failure to adequately address this escalating crisis not only threatens the nation's food security and economy, but also carries the significant risk of a wider public health disaster. The ongoing situation serves as a stark reminder of the fragility of our ecosystems and the vital importance of investing in robust surveillance systems, proactive prevention measures, and well-funded research initiatives to combat the ever-present threat of zoonotic diseases. The future hinges on our ability to learn from the present crisis and build a more resilient and prepared nation.